Hi.
Hello and welcome to Knock Knock Hi with the Glaucomfleckens. We are your hosts. I am Dr. Glaucomflecken,
I am Lady Glaucomflecken.
and we are so happy to have you here today. Kristen is ready. She just slapped herself in the face to get her to wake up a little
That's
bit.
what it takes to talk to you for this long.
This is actually the third time we've tried to do this introduction because we could not stop. I could not stop laughing.
We've got the giggles.
A little bit. And so we got a fantastic show for you today.
Yeah.
We interviewed Dr. Eyal BenDavid, who is a pediatric resident. And we're going to get to that in a second. But it was a fascinating conversation and one that I really enjoyed. I always enjoy talking to residents because their lives are so fascinating and they're learning so much. And it just always brings me back to my time in residency.
It's a very formative time in the life of a doctor.
It is. And just for those of you listening who have no experience in residency and don't really understand what all these words mean anyway, but your residency obviously is right after med school. So you graduate med school and you do your intern year, which is the first year of your residency program. And so residency can vary in number of years. So like internal medicine, it's a total of 3 years. Pediatrics is 3 years. Ophthalmology is 4 years. And neurosurgery is 17 years.
That's right.
And
Wait, here's a question I always had, and honestly still don't really know the answer to. Why, okay, if intern year is the first year of your residency, then why not just call it residency? Why is it like separated out as this different thing?
um, I think it's just it's a way to denote, okay, that this person is a resident, but they're a first year resident. So it's just
But like, who cares? Why do that?
because it's really hard to be an intern. I don't know.
Like, is there something qualitatively different about what you do in your intern year compared to the rest of the residency?
Sometimes there is.
Or is it just a way to say, like, this person might need extra support?
Well, I think that's a big part of it. But no, it is different. Like my intern year was totally different. I was doing rotations and all different
Right.
things and doing very little actual ophthalmology.
Right.
And
But
so
other residencies, it's not like that, right?
I don't know which ones there are, which ones there aren't. I don't know if there's like there's no reason that you can say first year resident, second year resident,
Yeah.
third year resident, but intern year is like it's the most difficult year of residency for a lot of people because the work hours are longer typically and you're like flying by the seat of your pants, just trying to survive basically.
Yeah. You're kind of getting the bulk of the grunt work, but also
get a
you're
lot
the
of grunt work,
newest.
and
Like,
you're
you don't
also-
know as much as you
Right.
will.
Exactly. You don't
Yeah.
know as much and you're learning an incredible amount of information. Like that intern year is when you learn really the most out of all your years of education and training. I'd say you probably even learn more your first year as an attending, but it's like a different type of learning. You're
Mhm.
learning different, like the system
Right.
more.
Business.
But as far as like learning medicine, you learn an incredible amount during intern year. And in my situation, you forget it right afterwards.
Mhm.
Most people don't do that. It's kind of a feature of ophthalmology. Maybe other ones too. But anyway, so we're going to be talking a lot about residency during this. And so I wanted to just give a little intro for all of you about residency. It's a very challenging time. It's also very exciting because you're going through it with a group of people that you become lifelong friends with, and you're all learning this field of medicine under the guidance of knowledgeable attendings.
But I mean, you're learning the field of medicine in med school, right? But residency, you're now focusing on the area that you've chosen
Right.
as your specialty,
And you're
right?
actually-
or
you're
as your area of practice.
Yes, and you're actually making the medical decisions yourself a lot of the time.
You are practicing as a doctor instead
the-
of just learning how to be one.
Exactly. And the hours are very long. Now there are work hour restrictions in place, but it's not unusual for interns and residents to be working 70 plus hours a week. So it's very time intensive, very stressful, a lot of fun at times, and also pretty crappy at times. And so this um, informs our discussion in this episode about resident unions. So we're going to be
Yeah.
talking a lot about that.
Because there's a lot of hierarchy in the medical field that, if you are in the medical field, you already know that. But for those of us who are not,
Mm.
there's a whole pecking order of how things shake out. And the residents and the med students are usually toward the bottom.
Right. Yep. There is a bit of a power dynamics and
Yeah.
hierarchies, and so uh, i- and so we do talk about, and this is something that has come up a lot more frequently lately. I think unions and residency programs are becoming more common and more popular. And overall, I think it's a really good thing. That's my thoughts on it. We're going to talk about it. So let's get to Dr. BenDavid. So Dr. Eyal BenDavid is again a resident physician at Harbor UCLA Pediatrics. He's a PGY2. And he has got an interesting background. Grew up in Israel, moved to California at age 10, and later returned to Israel to study at the Tel Aviv University Sackler School of Medicine. And he has a couple of interesting hobbies that we'll get to.
That's right.
So let's get into it. All right, here is Dr. BenDavid.
Do it.
All right, welcome, Dr. Eyal BenDavid. How you doing?
I'm
Good
doing
to
all
have
right.
you.
Good to be here. How are you guys
So
doing?
we're doing
Good.
great. I mean, you're taking some time away from residency, which
Mhm.
is a very busy time of life for a doctor. And
Yeah.
Yeah,
so you are in your second year, right? PGY2
that's right. Yeah,
at UCLA Pediatrics.
at Harbor UCLA. So
Har-
it's like one of the satellite hospitals, I guess.
Oh,
But
okay.
yeah,
UCLA is a big place, I guess, right?
yeah. UC. Well, we're a different residency than the UCLA residency,
Gotcha. Okay. So
and
you
we're
got
different. We're also county employees of the LA County.
okay.
So we're not UCLA employees. We're just affiliated with them.
I see. Okay.
Yeah, yeah.
And so you're is the primary hospital that you work at, is it a county hospital then?
It is. It's one of the three county hospitals. Yeah.
Oh, gotcha. All right. And then what are you doing right now as a PGY2?
Right now, I'm on vacation, um,
Oh.
which is the ideal time to be doing this kind of thing. But
Yeah.
I'm in between two rotations. Obviously, the one before was pediatric ward, where it's just constantly
Yeah.
go go go, and the next one is going to be an elective rotation at UCLA. So I'm going to be driving up
Uh-huh.
to Westwood, and it'll be a pediatric cardiology um, elective rotation.
Oh, nice, which is something you are interested in doing for your career, right?
Yes, yes, it is.
Am never I'm amazed by the never-ending supply of fellowship opportunities
Yeah.
that you have in pediatrics.
Yeah, it was one of those things that when I was considering a specialty, especially in medical school, when I wasn't exactly sure what I wanted to do, I was thinking emergency medicine, but I was thinking, well,
Mhm.
if I wanted to deviate away from that, it'll be a little more difficult. And then internal medicine, I wouldn't be able to do emergency because I was interested in that. But pediatrics, I could do pediatric emergency medicine, I could do pediatric cardiology, I could do general pediatrics. So coming into the residency, I knew I had a lot of different fellowships that were available.
Nice. And then, so you just got off of what, by the way, thank you for deciding to spend like some of your last remaining moments of vacation
Yeah.
It
on
is
a
my pleasure, really.
podcast with a TikTok ophthalmologist and his lovely wife. And so you're you just got off. You finished before you got on vacation. You were on the wards, which
Yes.
I don't really remember like my time rounding in like inpatient peds. I remember what it's like in internal medicine. And is it very similar? Are you like on your feet for like several hours every day rounding, seeing how many patients are we talking about?
Yeah. Well, yeah, some of it is on our feet. So most of the time, we do patient centered or family centered rounds where we round throughout the all the patient rooms, and we go into each patient room and we talk to the patients or to the families in as plain of language and try to explain everything that's going on and summarize. But yeah, how many patients? It could be anywhere between. Usually, it's capped at 10 per intern, and as a senior, I have
Gotcha.
the whole team. So we generally see anywhere between, if it's really slow, maybe we have 3 or 4 patients on our team.
Uh-huh.
And if it's pretty busy, we'll have 12, maybe 13 patients,
How many
sometimes more.
interns are we talking about? How many did they give you?
Each team has 2 interns.
2 interns. Okay. And are you a nice senior resident for the interns? Do you or
I'd
you or
like
just
to I'd like to think so. Um,
I'm sure you are. Everybody in pediatrics I feel like is pretty down to earth.
Yeah. I don't think I've ever met like a really mean pediatrics professional. I don't know. I've met some that are maybe quieter than others, but never anybody that's like rude.
Yeah.
yeah.
Seems like a good group of
Well, you
people.
got to have like a bit of a sunny disposition, like
Yeah,
in
and a
your
lot of patience.
because you're in a lot of patience to
Not not people
yeah,
patience.
we
The
could,
quality, the virtue of patience.
because obviously interacting with children. And at what point did you know pediatrics was the way you wanted to go?
So before medical school, before I even considered medicine as a field, I worked as a Hebrew school teacher throughout college, and I knew that I liked working with kids. I knew that I liked different age ranges. I worked with 4th graders and 7th graders. But when I was going into medicine, I was interested in like emergency. I was an EMT before,
Oh,
so I was
gotcha.
interested in
Okay.
emergency medicine. Um, and then in medical school, when I went onto the pediatric wards and I started rounding in peds, I said, you know what, I like this more.
And
So
this was whenever you went back to Israel to study at the Tel Aviv University,
that's right. Yeah,
right? Okay.
yeah, yeah.
Yeah, so what I know about your background is you grew up in Israel, then you moved to California for a lot of your childhood. Is that right?
Yes.
And then you went back over there to study medicine,
Yep.
and then you came back. And then, so did you just go straight to residency here
I just
from
like
Israel, or
to
how does that work?
I just like to rack up miles. So I just
Yeah.
Yeah,
just kind of go back and
can't
forth.
Pick up
decide
your
where you want to
mind.
be.
I yeah, I mean, moving when I was 10 to the United States was not my choice. It was something that,
Mhm.
Sure.
obviously my parents were,
Yeah,
had this
right.
opportunity, right? So they came to the US. It was supposed to be a short trip, like a 2-year trip where we're going to see Yosemite and Yellowstone and do
Hmm.
a lot of travels. And then we were going to go back. But then my dad's work got extended, and so we stayed a little longer,
Ah,
and then
gotcha.
we ended up staying in the US. And I always wondered, ever since I was a kid, what it would be like to live in Israel as an adult. Like what it would be like to live a regular daily life, knowing my parents' culture, my parents,
Hmm.
how they grew up and how they became adults there. So I had this opportunity when I got into medical school in Israel to say, you know what, I can experience that.
Yeah,
So I took
that's
it.
Very cool.
that's a cool opportunity.
That's the same way I got stuck in Texas. Supposed to be temporary, and then
Yeah,
that's where you end up.
because her family's all in Oregon, and so
Oh,
but
okay.
they ended
Yeah.
up, and that's where we met. And
Yeah. So, but your story really resonates with me of the like, so when are we leaving exactly? And then it just turns out to be never.
Yeah.
and then after you did your medical school in Israel, then you came. Did you have to repeat medical school here, or how does that work? Are you able
So
to just go straight into as like a foreign medical graduate? Is that basically how it works?
yeah, that's exactly it. So
Okay.
it was actually a special American program in the Tel Aviv University that's been around since I want to say 70s.
Oh.
Um, and what, you know, American students would come to Israel to study, Americans and Canadians,
Mhm.
to that specific program. And they would do their 4 years of medical school, take their USMLE step 1, 2, and then, come back to the US to do residency.
Oh, okay. All right. Were you always trying to get back out to California?
I think, when it came down to match and to thinking like,
Yeah.
where am I going to go when I'm going to end up, it wasn't quite clear. But I think that in the back of my mind, I always wanted to come back to California. Yeah.
Yeah, yeah. And did this now at what point did you decide to become in all of this timeline? At what point did you decide to become like the national champion in Latin ballroom dancing? because I honestly, I feel like I could just talk about this for the next 20 minutes. Yeah, please enlighten us, because not everybody has that kind of background.
It's a heck of an extracurricular.
It was quite the extracurricular. So in college, I medicine was not on my mind. I was not thinking I was going to go to medical school. I wasn't preparing to go to medical school, so I had to do a post bac later.
Mm.
Um, and what I was doing, I was studying psychology, and I had a minor. I was doing a minor in dance.
Oh,
And
really?
in that time,
Oh,
I
okay.
was every single day in the afternoon, I would go to the gym, and with my team, I would practice Latin ballroom. It would be cha cha cha, rumba, paso doble, the five international dances. And we had a coach that came up with a routine, and we, as a team, competed in that routine in the U.S. and we went to nationals in Ohio, and we won.
Wow.
That is
That's
incredible.
awesome.
Can we see some?
Is
Is
this
this
is is this
just
available on YouTube? Can we
It
go and
is. It is on
and
YouTube. Yes.
look
Oh.
at there you go. So this is a team competition?
Mhm.
Uh, you won as a team. That's so cool.
Yeah. I think it's ball dancing is so interesting because controlling your own body is hard enough, but then
Yeah.
with a partner and trying to go through a space with that partner is also difficult. And then
Mm.
taking eight couples in a team and making formations, it just a lot of layers of coordination and
Sure.
thinking in spatially, like spatial awareness.
Yeah.
Now, how did that help you become a doctor? Become a better doctor?
Now, I like to think, well, I like to think that that visual spatial reasoning that
Uh-huh.
I've developed through dance and through some other things, uh, I really that's one of the reasons cardiology speaks to me so much. You have to think so much in three dimensions. You have to
Oh,
kind of
yeah.
turn it in multiple ways and think about the flow.
Yeah.
Um, and
Sounds
so,
horrible. But again, I'm an ophthalmologist. Actually, you would have been a fantastic ophthalmologist because we have to flip everything
Oh,
around in
yeah.
our head because when we're
mm,
looking at the back of the eye, everything is inverted
oh
and
yeah,
Upside down,
backwards.
right?
Yep. And so we just naturally like learn how to flip that image whenever
that's
we're
interesting.
describing where like lesions are. It's like we see it, it's up and to the left, but it's actually down and to the right. So you have to like
You have to
figure out
reverse
how to
it
do
and
that.
reverse it.
Yeah. Yeah, but it's fine. You want to be a cardiologist, whatever. I'm not gonna hold it too much against you. But
But pediatrics, so he'll be a nice one.
yeah, no, it's we need obviously lots of good non-ophthalmologists in medicine. If everyone was an ophthalmologist, we'd have problems in society.
But
Um,
vision would be great.
oh,
It's
everybody would see
true.
really well.
Yeah.
Yeah,
Yep.
absolutely.
Well,
So
he's not just a champion at ballroom dancing,
oh, I also
He
yes,
also
yes, that's
you have
right.
a black belt.
Yeah.
Is that right?
Save
When did you do that?
Yeah, save some accomplishments for the rest of us, if you
Really?
would. Like, do you have to be good at everything you do here? I mean,
I well, thank you. So when I moved to Israel for medical school, there was a vacuum of dance in my life. All of a sudden, I wasn't really as active as I wanted to be, and in first year where I was living, there was a karate studio that was nearby.
ah,
And I did karate when I was a little kid. Like,
yeah,
I was doing some extracurricular outside of school. But when I was there, I went to the first class and I really fell in love with the way that they were teaching, the philosophy of it. And it kind of just drew me in. So I started to practice in medical school. So whenever I was in an anatomy class or doing my clerkships, I was either studying or practicing.
That seems like a really good way to let off steam during a stressful time. Med school's real
yeah,
stressful. It's like a physical, so you're moving your body, you're getting that exercise, but it's also got that mental component. I feel like would really be helpful when you're going through something like med school.
Absolutely. There's a component of it every single time session, single time we met, there was a meditation, like it's 30
Yeah.
seconds to a minute, where you just sit down and you close your eyes and you breathe. Everybody does this together. And in that time, it was my time to kind of put things in a box and say, okay, all of the, all the physiology assignments I have to do, I'm just going to put them away, and I'm going to think about what I'm doing now, the physical activity that I'm doing now. And at the end of the class, we do this again, where I'd allow things to come back, so I can, okay, what do I
Oh,
need to do for the rest of the day? What is my next? What's my week looking like? So I can,
Yeah.
and help me
oh.
structure.
Yeah, that is so helpful. I think that's helpful just in life, I think, to be able to do things like that, but especially in a career like medicine where, you're seeing one patient, then on to the next patient, on to the next patient. Sometimes, I mean, generally speaking, I don't really love the idea of putting things in a box, and I guess it's just a problem if you don't deal with it. But then that piece of bringing it back when it's an okay time to deal with it, I really do like that. I think that would be really
You
helpful.
trying to say something about me? Is that what you're?
There's no box I can put you in. You're too big.
It probably also your history with dancing, karate, and things can really have there's a lot you could do as far as like conversation starters with patients and their families. I
Or
And
imagine
pickup lines.
uh,
Your choice.
that's right. But I want to talk a bit about your residency experience because you just like we all do. Part of the reason I love having people like you, people early in their training um, on this podcast is because there are so many interesting formative experiences that you have in training that are at times embarrassing, sometimes amusing, and just kind of incredible, right? And so you gave us, you came with a list of a few of your kind of notable experiences so far in your medical education and
just a
training.
couple, just a
Yeah,
yeah.
yeah, it was a quite an impressive list, which
You wrote us a
I
novel.
was
I
very happy to see, and one a couple of these really stuck out to me. One was about a 16-year-old in a pregnancy test. I'd love for you to tell that story.
Yeah, that was wild. It was kind of a it was in the ED. It was an afternoon, kind of early evening,
Was this
and
what year of your was this in
this
your
is
intern
intern year,
year?
in my
Intern year,
intern year,
okay.
yeah. In my intern year. I think this is a little bit later on in intern year, so I was kind of a little bit more comfortable. Um,
Mhm.
she was coming in, and I honestly don't even remember what she came in for. But a lot of times we just do pregnancy tests on females of reproductive age, just to make sure that if they need any support and they need resources,
Right.
they can get those. And hers came out positive. So it was one of those things that I came into the room. I asked mom to step out, to do the one-on-one exam, and to just kind of give her space to talk if she needed to. And when it came to asking her, are you sexually active? Are you dating anyone? She said, no, I'm not. And I said,
Mhm.
I just wanted to let you know that your pregnancy test came back positive. Were you, is this something that you're expecting? And she kind of just went white in the face and was like, that's impossible.
Hmm.
And I was just, sat there like, I don't know how to respond to that,
Like, what do you say?
Yeah.
What do you
Yeah.
do? Oh my
Yeah.
gosh. Yeah.
And I said, we can repeat it just to make sure, just to be extra sure. She's like, yes, please repeat it. And I said, you want me to bring your mom back in? She's like, no, please do not. And I said, okay, that's perfectly fine. We went ahead and repeated it, and this time we did a quantitative HCG to make sure that it's not just a positive or negative. We get a number,
Yeah.
and it came back, and it was completely negative. It was zero,
Ugh.
or it's very close to zero at least.
Which is
So
probably the definitive test.
yeah, yeah.
Right.
So I went to the attending and I said, have you ever seen this before? Have you ever had a
Yeah.
beta HCG, qualitative that was positive, but then a quantitative that was negative? And they said, no, not really. I mean,
Oh, wow.
so it just kind of maybe it was a fluke in the system, like that another test was sent
Yeah.
in by accident. It's not
Yeah.
exactly clear,
That's where
but
my mind went. Are we sure that was hers?
maybe, yeah.
Yeah.
Human error happens. It's just, unavoidable sometimes, but it,
Yeah.
it could have been the sample itself that was contaminated in some way.
Yeah.
Right.
Unclear. So going back
False
to the
positive.
room,
Yeah.
Whew.
going back into the room, it's like kind of right outside of her door. I was like, okay, you got this. I can do it. And I go into the room. I said, you know what? You're, it came back negative. I'm so sorry. I don't know how that happened. That the first one was positive, and I'm so sorry that I freaked you out. it must be so terrifying to be told that you're
Yeah.
pregnant by a doctor in the emergency department.
Oh my
Yeah.
god.
And she was just kind of like, okay, yeah, that makes more sense. And I just kind of left with, I just don't even remember how I left. I just kind of left the room and
Yeah.
didn't know what to
You,
feel about that. But
you basically gave someone like the worst scare of their life,
Yeah.
but then also the most reassuring thing they'd ever heard.
Yeah.
yeah, you're
What a
definitely
whirlwind of
not pregnant.
emotions. I didn't know that was even a possible thing.
I mean, every test has
Yeah,
some
I
amount
guess.
of,
I
Yeah,
false
guess.
negatives and false positives and whatnot. But whew.
What a
that's
fun
true.
experience to have as an intern.
Yeah,
Yeah.
definitely fun. And nobody else that I've talked to has ever had anything similar. So just a fluke.
Yeah.
And
Wow.
you also have a great story that I actually related to quite well because it's a thing that I would not do very well with, and that's things that have to do with nails,
Oh,
toenails, fingernails.
yeah. That
Terrible.
that was uh
Everyone's got a thing, right? Everyone's got like a thing in medicine that you just that
Yeah.
we've talked about this before that you just don't do well with. Like for me, it's like
Teeth.
it's teeth. For
teeth.
you, it's
Okay.
eyes,
Yeah.
which is funny being
Well,
an
for me, it's pretty
ophthalmologist.
much anything. I don't, bodies are gross.
And what happened to you? What did you have?
But Kristen, I think that eyes thing is pretty common.
Oh,
I've
yeah.
heard that
Oh,
before
it's very
too.
I
common.
think he's
Yeah.
the weird one in that.
Oh
Yeah.
yeah. No, it's just a question you get asked when you're interviewing for residency is do you think eyeballs are gross?
Are
It's
they icky?
yeah, you have to be able to answer that one
It should be a
correctly in order
prerequisite
to
question. Yes.
yeah,
Yeah.
it should be on applications. Absolutely. Do you realize eyeballs can be a little nasty at times? No,
Yes.
but you had an experience with a toenail.
Yeah.
And it's a toe. I was hoping it was
It,
a
Oh
fingernail.
yeah.
It's
It
a
no.
was
toenail.
a big toenail.
A big
The
toe.
big toe. Yes.
Oh,
And this
okay.
is not an
Bracing
uncommon.
myself.
This is not an uncommon thing in the emergency department
Yeah.
either. So
We have to like, remove a toenail basically.
yeah, or you remove a part of the toenail. So
Yeah.
uh,
I know.
and this is
I
I'm not
can't.
sure I'm going to make
That's
it through.
that's
Whew. Okay, deep
in
breath.
what situation would you have to do that?
so when there's an ingrown toenail,
Oh, okay. All right.
when the nail grows into the side of the tissue and starts to get infected, and so you
Okay.
have to remove it to let the part heal, and
And
then the patient will
and
go back
and
to.
you almost passed out
I
having to do
I
this.
almost did. It was the first one, so I went with another.
Yeah.
I went with one of them, my seniors,
Yeah, yeah.
and we went to the patient's bedside, and got everything ready to go, and then he starts injecting the lidocaine into the joint space, and I said, I've seen injections before, but into the joint
I think
space, a little
I
bit,
might pass out.
questionable, but fine. Okay, I'm okay so far.
Yep.
And then, do you feel this? Do you feel this? The kid says, no, it's okay. And then it comes to the pliers, where
Um,
digging underneath the nail,
No.
like putting,
yeah.
clamping it down, and then the twist, right? So the
Ow!
twisting the nail out of the nail bed, like from the side.
Yeah.
And
Oh.
then once it's
I
out and
yeah.
vertical, then you can clip the bottom of it off.
Ugh.
So then
You know what?
you're
I
rest
could
with left like half the nail is remaining.
Why did you ask him about this one?
I thought it
There
was
were so many to
interesting.
choose from.
I can totally see how that could really you know, uh, induce some kind of vasovagal response.
Yeah.
Yes.
So, this is another reason why I don't think I could
Should I
ever be an
be
emergency
seeing black
physician.
dots
Yeah.
right now?
Are you feeling a little lightheaded yourself?
Well, I did, I was there, I was helping. I mean, I was doing the procedure, and with my senior, it was really nice that he was there, because if he wasn't, I don't know that I would have
You
been able to do it all the way through, at least on the first time by myself, obviously.
yeah, yeah.
But
And then now as a you've been a pediatric resident now for a couple years
At least their
and
toenails are smaller.
at least they're smaller, but I've always been very impressed by, especially my colleagues in pediatric ophthalmology, that are able to do procedures on children, like even at a fairly young age. Um, and sometimes you can do them without like general anesthesia, and you're
We
able
can't
to.
even get our kids to go to bed. So,
So I find it very
yeah.
impressive that you're able to get as much done for kids that you're able to do. I don't know. What's your approach to like, you know, I guess how often are you able to? I mean, that's not something you'd be able to do to a kid without putting them out, right?
I don't know.
Do kids even get ingrown toenails? I don't think I've ever seen a kid with an ingrown toenail.
Kids do. I mean, I think especially school age kids or even teenagers,
Yeah,
and they would still
yeah,
come to the pediatric emergency department. So maybe up,
gotcha.
up to 21 years old. But there are, like small babies you need to do a lumbar puncture for sometimes.
Oh.
Oh yeah.
And, instead of sedation, they give them sugar.
Sugar?
Like
What?
sugar,
Really?
yeah, there are these sweeties that's like a syringe of glucose that
Uh-huh.
you give them a
Oh,
little bit and they just kind of like mellow out.
really?
Yeah.
Oh, that's
It was
interesting.
amazing when I first saw that, where you give them a little bit of sugar. They've never had so much sugar before, and
Yeah.
Yeah.
it's
Just
such a
They're just,
such a
refreshing
like,
thing.
high.
It's a
blissed
high,
out.
it's a sugar high, yeah.
Oh my
Wow. Oh, I didn't no
goodness.
idea that happened. That I'll put that on the list of kid related, like baby related things that I had no idea happened. Like that they give caffeine
Oh,
sometimes
yeah,
in the
and then
NICU.
mhm.
That's something I learned just
Mm.
because I had to make this stupid video about neonatology. I mean, I had to like do a lot of research for it, and that's one thing I learned is that actually, caffeine is given for certain
Well,
things.
maybe we should try the sugar trick next time they won't go to bed.
Oh, our kids have had plenty of sugar already. That would not phase
That's
them.
true.
It's actually the caffeine thing is a funny experience that I had when I got a call from a pharmacy saying that I actually don't remember which it was, but D5 or like 5%
Uh-huh.
dextrose and normal saline versus normal saline. And the pharmacist or the pharmacy assistant was asking, "Hey, doc, are you sure that we can give caffeine with the D5 normal saline and not just the normal saline?" And I was like, I sometimes take sugar in my coffee, so I mean, I was just thinking, like, would that make a difference?
Yeah.
What's the answer? Is
The
it
answer is
okay?
Well,
fine. Yeah,
That's fine.
yeah,
because sometimes with kids, it's different,
Yeah.
They their
I didn't
bodies
know
are
if that was
weird.
gonna be something like, how sometimes in order to make you not feel bad as like a brand new doctor, they'd be like, "Are you sure you didn't mean to order
Right.
this? That's actually the correct thing and not the terribly incorrect thing you just ordered." That's why I love pharmacists. They
yeah.
always they're so nice about that stuff.
I've been saved several times by
Oh yeah.
benevolent pharmacists.
Well, another thing I wanted to talk with you about, which is a little bit unique in your experience, is your experience with the union that you have for your residency. Now, this has been a topic that's really, it seems on social media, on Twitter in particular, you see more and more programs and residency programs that are doing this. And so, tell us a little bit about uh, the union and your experience with it.
Okay. So our union is CI.
Without getting in trouble. I don't wanna get you into
No,
trouble.
of course not. Um, I wanted to make sure I emailed our union saying like, hey, by the way, I have this public facing event
Uh-huh.
that's coming up. I just wanted to make sure that everything is fine. And we had a chance to chat a little bit too. So
Oh, good, good.
yeah, our union has been honestly, I had really great experiences with them. When I came on as an intern, our salaries were probably some of the lowest in the nation.
Mm,
And during my intern year, there were a lot of bargaining sessions with the county to advocate for the residents, to advocate for us to have better benefits, better salaries, a housing stipend that's significant for the area that we live in. And our union was able to provide that for us and was able to come to an agreement with the county about
hmm.
you know making that change possible.
What now, was the union in place before you got there?
Yeah, it's been around, I think, since the 70s. Um,
Oh, wow, okay.
yeah, here
Alright.
specifically, but now I think throughout the nation, not just in medicine, you have all these, Chipotle, Amazon, Starbucks, unions
Uh-huh.
are being a lot more encouraged.
Yeah. I just I feel like I'm hearing it more with residencies in particular. And so is this a union it's not specific for pediatrics, is it? Or is
No,
it's all the residency programs
yeah,
under at that are affiliated with the hospital that you're at? Is that
with the county.
And so what would you say to that type of criticism of resident unions?
I think there are. I mean, as a resident, and I know there are people who know more about this than me that can bring up facts and research about this. But I think that the counter argument is that if you're in the hospital for 96 hours, how well are you actually learning? What are you getting out of that experience, as opposed to having set, hour limits, so that when you do come to the hospital, you are fresh, you're ready to learn, you're ready to take care of your patients, and
Mhm.
you're at a place that you're financially, you're more secure, you have benefits, you have healthcare that you need, so that when all of your hierarchy of needs is being met,
Mhm.
you are able to provide that care for the patients that they
Yeah,
deserve.
quality over quantity of education.
I think also the quality of life in terms of like financial stability, like you mentioned, is
Yeah.
is huge because
Yeah.
that's a burden on these students that are coming out with several $100,000 of debt, and to yeah, me us too, yeah, um, and
Not
and
me, just you.
and to just be able to advocate for yourselves, to just have be able to live and not have to be able to focus on your residency education
Yeah.
and not have to worry that you're going to be able to survive financially in some places like where you are. That's a pretty expensive place to live, right?
Yeah.
And so it's more than just the hours,
I think it has a big effect on mental health too, right? Like right now, there's this big crisis of physician suicide, and I think that's obviously a complex problem with many facets. But one of them, I think, is that you put so much investment in a medical education that if at some point along the way you realize you don't want to do this career, you feel so trapped because you are, hundreds of thousands of dollars in debt. And how else are you going to pay that off except to follow through with this and try to specialize in something that pays enough? And if that's not something you want to do and you just don't see any way out, I think that can be a contributing factor sometimes. So if we were to make it where residents could be a little more financially stable and not be so reliant on loans, I feel like that would go a long way in that problem as well.
well, and they're getting loans earlier too, and
Yeah,
and so
undergrad and med school and
and yeah, I think just trying not to disillusion doctors, you know, too soon. I mean, that's part of it, right? You don't want new physicians coming out of training and already being so beaten down that they no longer love medicine.
yeah.
And I see the unions as a way to help, foster the just an improvement in mental health, an improvement in where doctors are from physically and mentally once they graduate and start really the bulk of their career.
I absolutely agree, and I think that having a union and being a member of the union, it's one of those things I don't think about every day. I don't think about, oh, my union's there, but the fact that they're there for me as a support, as like a safety net in a way, and I
Mhm.
know that I can reach out to them and say, hey, I'm having this issue, or hey, this is something that's going on, and can you guys help? Is huge. It's huge to have that kind of advocacy for on our behalf, and that support.
Yeah, and it's not like you guys are advocating for anything crazy. Like,
Well, we're gonna get to that
oh,
because we're gonna do a little thing after the break.
okay.
Let's take a quick break and we'll be back with Dr. Eyal BenDavid. Hey, Kristen, I have a PSA for you and all of our listeners from our friends from Tarsus.
Let's hear it.
You know how sometimes you can get red, itchy, irritated eyelids?
Okay.
Well, do you know what that might be?
What?
Eyelid mites.
No.
Yeah, it's true.
No.
It's a disease. It's called Demodex blepharitis.
That's disgusting.
It's pretty common.
That's horrifying.
So if you have itchy, red, irritated eyelids, go talk to your eye doctor. They can take a look at you.
Tell you if you're not alone.
That's right. But don't freak out. Just get checked out. All right. To find out more, go to eyelidcheck.com. Again, that's eyelidcheck.com to get more information about Demodex blepharitis. All right, we are back with pediatric resident, Dr. Eyal BenDavid. So this whole union conversation really has me thinking. And so what I wanted to do was a little activity here that I call "Can the union do this?" See, I've never worked in a union. I don't know much about unions. I don't know what they can do, what they can't do. And so, to the best of your ability, I came up with some things I thought would be like awesome as a resident to have. And then I'm going to ask you, can the union do this? And so these are things that like, okay, you have an idea. You're like, okay, you go to your union rep. Is that how it works, right? You go and talk to your, is it a resident
Let me
rep
give them.
or is it
Let me
actually
text them real quick. Let me just.
get them
Should we
on
get
the
them on the
phone?
line? Yeah.
Or like, so if you have something you think needs to change, who's the first person you go to? Is it your own co-resident rep or is it somebody outside of your residency that you're contacting?
I think it's outside of the union. It really depends on what it is. I think most of the time I don't go to the union directly, but rather to my program directors or my chiefs, because a
Gotcha.
lot of the moving parts are within the program itself.
Mhm.
Right.
So I don't think that I've ever really needed to go to the union for anything major. But yes, if there
Oh,
was
good.
anything
Okay.
that was, I would go
All right.
to the rep.
All right. So here we go. Can the union make this happen? Can the union? All right. Here's the first one. Um, get the day off on your birthday every year. Can the union make that happen? What do you think?
I think. I think theoretically they might be able to do it.
Yeah,
Oh.
they
They
should. It's your
it
birthday.
could be a part of the contract that's now every resident on their birthday has the day off. It's mandated.
There you go.
Can
Put it in
we
the contract.
You're not thinking big enough though. We need to go to birthday month.
Up. I think I think asking for a month off around your birthday is a little bit much.
Well, I was planning to take one just so you know.
Well, you got a little bit more of a flexible schedule. So okay, so put it in the contract. I like that. Put it in the contract. All right. Free parking. Do you have free parking right now?
That's
I,
always
I do.
You do.
I
Is
do.
that?
I
very
Do you
do.
think
lucky.
that's a something that the union helped you put together?
You know, I actually
Could be.
I'm not sure. It could be.
If your residency program, if you're listening, and your if they don't have free parking, all right, get the union on it. I
Mhm.
think that's something the union should be able to
That's a
do.
contentious issue.
I mean, parking. In the past, we've asked for feedback on like when I've talked to like administrators in hospitals. That's like the number one thing people like want. They want better parking. They want close to the hospital. They want free parking. It's a huge deal. Um,
Yeah.
do
Thankfully,
you have?
we have a parking structure. I think it used to be one floor, and then they built a structure,
And they
so
let you park there?
we are allowed to park there. Yes.
Good, good. That's good. I remember when I was in med school, so I was at Dartmouth, which is a big campus, and there was a lot that all the residents had to park at, um, which required like a shuttle bus to get to the front of the hospital. Not great, not great. All right, here we go. Snacks, just everywhere. Snacks, the call room snacks, workroom snacks, just snack. How are you doing on snacks, Eyal?
You know
Do we need to
what?
send you some?
We I think one of the perks of being in peds is that our chiefs buy us snacks, and we have a candy bowl in our resident workroom
Uh,
that's
okay.
always filled.
It's
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 like
stocked.
a bottomless candy bowl.
Somebody's looking out for you
See,
guys.
people, I think they underestimate peds in that way. That it's one of the snack heavier specialties.
That's
How about
right.
stickers? Do you have it never ending stickers next to the candy?
You could
You got
probably.
some
Oh,
stickers right there.
oh my God! We said that he pulls up
A whole sheet
a
of
whole sheet of
stickers.
Oh,
stickers.
1 second. Sorry,
That's
there's
amazing.
Oh,
just a second. Sorry.
you
He's-
got lots of
Is
stickers.
that
oh,
is
he
that
Oh,
also is wearing a rainbow unicorn headband.
he stepped it up a notch. His is
That's
better than yours.
that is actually I'm a little bit jealous about
there's
Yeah.
that
two? You see
headband.
this?
Two
There's
unicorns
two
with a rainbow in
unicorn
between.
two unicorn heads and a rainbow in between.
That's amazing.
I should have done peds. I don't know. It's whew, man. We could use you in optimal. Hey, do you want to like go back and do a different resident? Do you want to do ophthalmology residency real quick? And then
Mm,
you can do like just an additional pediatric fellowship and then become a pediatric ophthalmologist. I'm
Tempting,
just
I
saying,
know.
like, think about totally changing your entire career around,
yeah,
so that I could personally benefit and my practice.
right, right.
Anyway, just an
I
idea,
heard a
just a
job
thought.
offer. I don't know what you heard.
All right, so we've established that there's no shortage of snacks in, but I feel like the union could help with snacks.
I think they probably could. Again,
Meal card, I don't know, like something, something.
you know what our union did as part of this new bargaining session. We now have offsite like money allotted for meals. That's
Oh,
per
good.
day.
Pretty
So we
sweet.
have our
Oh,
meals
nice.
that if we do outside
Like a per diem.
rotations, we have every day we have a certain amount of money for meals,
There you
which
go.
is great.
That's good. The union can do it. That's
Yes.
good. See,
Can
that's the
and they
one thing.
did.
Like if you're as far as helping out just mental health and burnout, like I know the joke is always, oh, another pizza party, whatever. But honestly, like feed the
It's
residents as
yeah,
much food as they want. Like I really think that would go a long way to just overall happiness.
right. I mean, you guys, we are at such a low point that all it takes is basic human needs.
Yeah.
That-
If you
let-
just were to
let's
fulfill the basic human
let's raise
needs,
the floor a little bit, everyone,
yeah,
And
and then we can go from there.
let them sleep, let them eat, let them pee. I mean, this is what you're asking for at this point. It's really
That's
yeah.
right.
the bar is low.
All
And
right.
props to Harbor UCLA. We have 3 meals a day for the residents.
Oh,
Oh, that's
nice.
awesome.
So
Yeah.
that's something it's a
That's
And
great.
time to go eat them?
yeah, most of the time
Most of the
I
time.
think it
A
really
little
you know
hesitation
Let's
there.
grab
know
and go. That's
if
okay.
it's
Grab
a
and
really
go.
busy day, sometimes it's like, okay, well, somebody will get it for the whole team. But
Oh,
I think for
okay.
the most time, we're able to manage that.
The point
Yeah.
is, you never have to eat anything off of a patient's tray because you have food available to you.
Just pick it off right out, like on the
Yeah,
walking by the
that's
patient
right.
room, just picking it as you're walking.
Kids, they don't eat their
Patients
vegetables.
love it.
You could. All right, all right. How about student loan repayment?
Mm.
I don't think I've ever heard that from you. Can the union pay your student loans for you? Don't answer that.
No,
Don't
yeah,
answer that.
I'm gonna go ahead and pass on that one.
You're
Plead
gonna
the fifth.
plead the fifth on the student loan repayment. Okay. I just think it's possible. It's hey, these are
Just
just
think about it.
ideas. Can the
Take it
union
back
do
to your
this?
rep. Just think
All right.
about it.
Unions, can you help a little bit with a little, income-based repayment maybe? Okay. Can now maybe I've seen too many movies. I don't know, but can the union physically intimidate mean surgeons to make them nicer to students and residents?
I think that the union generally is on the surgeon's side,
Oh,
not
they
against the
are?
students, but the residents that are the surgeons.
Right,
Oh,
right.
okay.
I guess I meant like
You mean the
attendings,
attendings,
like
Oh,
yeah.
I
the
see.
mean
I
attendings.
I
think
see.
Yeah,
that's your job. I think that's what you're doing is shaming attendings into better
Mm,
behavior.
I guess that's what I try to do. But
Yeah.
again, that's why it's like I don't know. Does the union have like muscle? Like
they should hire some muscle. Yeah,
Yeah.
like real intimidating people.
yeah.
There's like stop throwing things in the OR or they'll bust your kneecaps.
You
That
know,
kind of
what's
thing.
that group
Or
where they
maybe I'm thinking of the
send
mob. I might be thinking of the mob.
I think I'm just imagining like a big guy in like aviator sunglasses, just
Yeah, and he
peering
just like
through like an OR like the window from the door. Just
yeah.
Exactly. Hey, you better be careful. We're part of the union.
Yeah. I'm watching you.
Okay, I got one more. So I don't. Well, so just to recap that one, I guess the union probably doesn't want to
I
hire
think that's a
people
no.
muscle
Yeah.
to
Mhm.
intimidate people that aren't behaving appropriately. Okay, that's a little bit pushing it. Eyal, what is your favorite thing in the cafeteria at your hospital?
oh, um,
What do you like? What do you like to eat there?
I think so. They make really, I think, pretty good plantains on
Oh,
Plantains.
interesting.
On Taco Tuesdays, we have
Yeah.
plantains, and I think I really enjoy that. That with the Beyond Meat like vegetarian option.
Okay. All right. Here we go. So L.A. County. Um, can the union please get some all you can eat plantains and
Yes, that would be
Taco Tuesday, just all you can eat tacos, as many plantains as you want. You want some guac. You can
please.
yes.
Guac would be much
I
appreciated.
I absolutely. I
Yeah.
think that should be doable for the union. All right. So
Excellent.
anyway, that was can the union do this? Did I miss anything? Is there anything else the union can do?
I
Is there
think they could.
anything that's like in like you guys are talking about? Maybe you can't even say this, but like what's next? Is there something? I feel like is there always something that the union's working on?
I think right now they're working on making minimum wage for all healthcare workers $25 an hour. Not specifically in California. I think it's
Yeah,
in California, but they're trying to
yeah,
raise that, and
I
it's a
love it.
bill that's going through government right now, or
Oh,
that they're working
nice,
on. Yeah,
very nice. In the California legislature, you mean, or is this federal?
I I
You
think
don't
it's
know. I don't
California, but
know.
I'm not sure.
One of the two. Anyway, it exists, and I think that's great.
Yeah.
$25 per hour minimum wage.
How does that work when you get like a monthly stipend instead of paid by the hour? Like,
Well, I think we're probably thinking more for like hourly
Hmm.
workers.
Yeah,
Yeah,
yeah.
yeah. So because there's a lot of
like
hourly
wage
healthcare
versus
workers.
salary.
Yeah, exactly.
Yeah.
That's great. I love it. All right. Well, let's take one more break, and then we will come back with some stories. All right, we are back with Dr. Eyal BenDavid, and we are going to look at some of our favorite medical stories that were sent in by you, the listeners. All right, Eyal, so we got a couple of good ones here. We got a fan story number one from Jess. Dear Dr. G, thinking of funny moments from my medical training recently and thought I'd send you this one. I was working as a resident on a cardiology rotation, and we were gathered around the telemetry screens, listening to the registrar talk about some gripping cardiology topic like P waves.
I'm sensing some sarcasm.
Do you know what telemetry screens are?
I,
That's
ish. They're the ones that move around, right?
yeah. So like, and then so you have all the patients admitted in the hospital, and there's a screen that has all their heart tracings on them. So it's like like monitoring all their heart
Oh,
rhythms.
okay. That's not what I thought.
It's
I thought it was, the ones that are
like
on
a really boring
wheels.
TV.
They're like mobile.
Uh,
Never
what?
mind.
What are you talking
We'll
about?
talk about it later.
I think you're thinking
Okay.
of the vitals machines.
Maybe.
Yeah, to take like a blood pressure.
I don't think she knows
I
what
don't
she's
know
thinking
what
about.
I'm talking about.
Anyway, so we got a
Okay. P waves.
resident on a cardiology rotation gathered around telemetry screens talking about something fascinating like P waves. Suddenly, one of the monitors showed ventricular tachycardia. The registrar sprung into action and ran into the room of the patient with his arm held high above his head and gave the patient, who was lying eyes closed on the bed, an almighty precordial thump and then tried to commence CPR. The patient's eyes popped open and he struggled to sit up while the registrar was attempting to start chest compressions.
Oh,
The patient batted him away, groggy and bleary eyed from his sleep, and growled at him, I'm not dead yet.
no. See, this proves, I always tell people when I'm advocating for learning CPR, you can't hurt them if they don't need it. They'll let you know.
that's,
That just proves my point.
that's true. Oh, man, I can't say I've ever been in that situation.
No,
I
you
don't
were
know.
dead. So,
Well, I
yeah.
was the patient side of things. Yes. A precordial thump. Have you ever given out a precordial thump, Eyal?
I've never thumped a patient,
I've never
and not yet, at least.
not yet. All right. Let's hope you never have to. But nobody in this room on this podcast has ever thumped a patient.
Well, I don't, have I?
I don't think you did. You ever
Does that
thump
count?
me?
I don't, I
No,
give
you
you a
just
good,
compressed me. Compressions. That's all. No thumps. I don't even know
it's
what
like
that
a,
even.
like a,
I think it's like a real hard tap, like wake up kind of thing. I don't know. Or like stun. Please don't.
like that.
You just precordial thumped me.
Did I? I didn't even know what that meant.
I assume that's what it is. I'm an ophthalmologist.
You don't
I
know
even
either.
Okay. Fan story number 2. We have Helen. Helen says, fledgling trainees passing out in the hospital or an anatomy lab is a pretty classic tale. That's true. We've already talked about that.
Mhm.
When I was shadowing in the emergency department in undergrad, I saw all of these normally traumatic events: someone's shins run over by a lawnmower, gunshot wounds, a patient with altered mental status who chucked an IV pole at me. I was actually really unfazed by all of these sights, and it was honestly exciting to be in the middle of the trauma bay. But during a lull, I followed a resident into a room with a suspected STEMI, so a heart attack for the ophthalmologist who haven't read an EKG in years. Thank you for that, Helen. I really appreciate that. It's good to know your audience. And the patient was a nice old man sitting up in bed with his wife next to him. They hadn't even started an IV on him yet. He smiled at me and said, "Hello, young lady. How are you doing tonight?" And I felt my ears go numb and my vision go black all around the edges. And next thing you know, the resident is in tears laughing at the kid who was absolutely rabid over the gory traumas and got KO'd by a grandpa. The patient turned out to be fine, and I have now pledged to join a specialty that only requires me to see the goriest of traumas.
Helen, you and I are very different people.
Yeah, that's totally backwards. That's so I've never heard that. Like you're fine with all the gross, gory stuff, and then it's like the
What
medical
even?
heart attack grandpa that
Yeah.
made it
What would have
happen.
triggered that? Being talked to?
I don't know. That's a good question, but that's fascinating. Thank you, Helen.
Yeah.
You can send us your stories, knockknockhi@human-content.com. Eyal, thank you so much for joining us. It's been a pleasure talking with you.
Thank you so much for having me. It's been such a
Now,
pleasure.
before we go, do you have anything you want to share with our audience?
I think to all the residents who are currently, and attendings and medical students about to be residents or that will someday be residents, just treat your patients like, their extended family to some degree. You want to make sure that you're giving them the best care that they deserve. And the way that I always think about it is just like I think about them like a nephew or a sister or my own, father when I was working in adult medicine once a
Yeah.
month.
Well said. Well, thank you so much again for joining us, and good luck to you with residency, with however many fellowships you have to do to get to where you end up being in life.
If you want to cash in on that job offer, just let me know.
I'm just saying,
Yeah.
just think about it. Ophthalmology, we could use many more pediatric ophthalmologists, and then also good luck with your union. Get them on those infinite plantains.
That's right.
I don't think it's too much of an ask.
I think
And
I'll write a strongly worded email.
Yeah.
sounds good. All right, take care, Eyal. Well, that was fun I love, again, talking with people early in their career.
Yeah. It's my favorite too. Because they're just so smart and eager, and they haven't just been totally destroyed by the system yet like the rest of us.
Which doesn't necessarily have to happen, everyone.
Yeah.
It just
Can the union do that?
can the union, it's just a fair ask, can the union preserve the enthusiasm for medicine?
Yeah.
Just in general,
I don't know.
across the board.
Yeah. Doesn't seem like too much to ask.
Actually does seem like a lot to ask, but anyway, it was a lot of fun talking to him. We need to get more residents and kind of young,
med
early
students.
career people on med students. Get some med students on
Yeah.
here. Maybe even a pre-med.
Ooh, now you're just
How
getting
about a child?
crazy.
How about like a
child.
10-year-old? Give it.
Shall we get our kids in here? Just
Eventually.
let them run the show.
And so let us know what you thought. I'm just rambling on at this point. I guess we should probably wrap up this episode. Let us know what you thought. And do you have any suggestions for stories or doctors or anybody that we should have on the show? Lots of ways to hit us up. You can email us, knockknockhi@human-content.com. We're on all the social media platforms, TikTok, YouTube, Instagram, all of it. And you can also hang out with us in our Human Content Podcast family on Instagram and TikTok at Human Content Pods. Thanks to all the wonderful listeners leaving feedback and reviews. We love seeing those reviews. If you subscribe and comment on your favorite podcasting app or on YouTube, we can give you a shout out. Like today, 23 Dr. Kim on Apple said funny and educational.
Short and to the point.
Yeah, I love it. I'm a big fan. Have you seen
both
ophthalmology
of those
notes?
things.
We are big on acronyms, and we try to keep it short and sweet.
Short and sweet. And
Not as short as the orthopedic surgeons. They win for the brevity.
do they
of
just
their
say
notes.
bone or not bone?
Well, it's always bone. If it's not bone,
Why
why
are
would they
they in
even be
ortho?
doing anything?
Yeah,
But
good
yeah,
point.
essentially, it's
Yeah.
either that or all emojis. So keep sending us your stories, jokes, and guest ideas. YouTube episodes are up full video episodes are up on my YouTube channel every week at Glaucomfleckens. We also have a Patreon, lots of fun perks, bonus episodes where we react to medical shows and movies, hang out with other members of the Knock Knock High community. Lots of really cool people over there, by the way.
Yeah, come join.
Like much cooler than us. We're
That's
there
true.
and would love to interact with you. You can get early ad-free episode access, interactive Q&A live stream events, much more. Patreon.com/Glaucomfleckens or go to Glaucomfleckens.com. Speaking of Patreon community perks, new member shout out to Mark K, Laura K, Donna, Melissa S, and May Q. Welcome. Thank you so much for being here. Shout out to all the Jonathans, Patrick, Lucia C, Sharon S, Omar, Edward K, Stephen G, Ross Box, Jonathan F, Marion W, Mr. Granddaddy, Caitlin C, Brianna L, Chaver W, Jonathan A, Leah D, and K L. A virtual head nod to you all. Patreon Roulette, shout out. We should tell them what Patreon Roulette is.
Yes.
It's an emergency medicine tier of Patreon. We give you a random shout out. So drum roll. Shout out to Jonathan A for being a patron. Thank you. Thank you, Jonathan. And thanks for listening. We are your hosts, Will and Kristen Flannery, also known as the Glaucomfleckens. Special thanks to our guest, Dr. Eyal BenDavid. Our executive producers are Will Flannery, Kristen Flannery, Aaron Corney, Rob Goldman, Shanti Brook. Our editor and engineer is Jason Portizo. Sorry, Jason. Our music is by Omer Binsby. To learn about our Knock Knock Highs program, disclaimer and ethics policy, submission verification, licensing terms, and HIPAA release terms, you can go to glaucomfleckens.com or reach out to us at knockknockhigh@human-content.com. And with any questions, concerns, or I'm having trouble talking.
Are you stroking out?
I
Do I
don't
need
know
to be
what's
worried?
happening. Anyway, I'll be better next time. Knock Knock High is a human content production.
Knock, knock. Goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.